This one right here, but now we have two new ones in here. Good morning, Decatur. Happy Christmas week. I know this holiday has looked so different for all of us, but we still have a lot to be thankful for. Our medical professionals, a vaccine is coming out, and the first doses being administered last week to our healthcare heroes. Today we are joined by a phenomenal representative of the Decatur Morgan Hospital, Dr. James Boyle. Good to have you with us.
I didn't know I was phenomenal.
Not only you're phenomenal, but you're a friend, and we appreciate your leadership and everything that you've done as a physician. And I know there's many physicians that are working very hard, and the staff that supports y'all, thank you for your work.
I appreciate the invitation.
Sure thing. So, an update on our COVID cases. Morgan County last week, we saw our second highest daily case increase of 144 confirmed cases today. We have 8,324 confirmed cases and another 1,140 probable cases. Our 14-day percentage positive rate is still increasing and now stands at 52.96%, meaning there's a greater than 50% chance that if you test for COVID, you will have it. So the holidays are here, and unfortunately these next few weeks can be a hard time for so many. Now more than ever, remember to check on your friends and loved ones, and especially our young people and our elderly residents. To those who have lost loved ones or have loved ones in the hospital right now, please know that that we are keeping you close to every thought and prayer, and it's okay not to be okay. Neighbors, in this season, the holiday spirit, be uplifting and reach out to those that you know who are suffering during this challenging time. So with that, Dr. Boyle, you want to give us an update from the hospital?
I will. Good morning. So let's start with some numbers. The last time I presented this data before this audience was in September, and I thought it might be useful to compare the current numbers to the September data and give you an idea of how things have changed over the last 3 months. The total number of cases in Morgan County off the ADPH website this morning was listed as 9,464 cases. That's more than 3 times what it was when I saw you in September at 2,962. The number of deaths have also more than tripled. I previously reported 24 deaths in September, and we are now up to 78 deaths in Morgan County. Our number of hospitalized patients have increased by 4-fold. We had 18 patients at my previous report, and now we're up to 81, and that includes 17 on the Parkway campus. The coronavirus patients on mechanical ventilation also have more than quadrupled. I previously reported that we had 4 patients on mechanical ventilation. As of this morning, we have 16 patients on mechanical ventilation. That's 85% of our ICU beds are on mechanical ventilation. We're using 100% of our beds, and 85% of those have COVID patients on life support. Our peak number of patients came after the Thanksgiving holiday and was in the low 90s. Several patients were infected during holiday gatherings. Some have died and some are still in the hospital. We have had borrowed ventilators from another hospital in our system so that we did not run short. Patients with coronavirus frequently will have long hospital stays. We have one patient that is hospital day number 200 today. This patient was middle-aged and had no other major medical health problems. This patient is tested negative for coronavirus and so no longer is listed in our coronavirus numbers. We anticipate that we'll have another surge in admissions after Christmas. Counties all over North Alabama have reached record numbers of new cases in the last week. We now realize that it is quite possible that we will exhaust all of our resources, and we might have to decide which patients get the resources we have available. I do want you to know that we do have a limited supply of monoclonal antibodies to treat coronavirus. You might recall that President Trump received Regeneron, which is a combination of monoclonal antibodies. The goal of these treatments is to treat patients at risk for severe illness to prevent hospitalization If you test positive and have mild to moderate symptoms and you are obese, you have a chronic medical illness such as diabetes or kidney disease, or if you are 65 or older, you probably qualify for this infusion. You need to know that you have to take this drug before you get sick. You can't receive this medicine if you are sick enough to require hospitalization. We get a limited number of these infusions each week, and we distribute them on a first come, first served basis. If you think you might be a candidate for this medication, please call your healthcare provider. We have started vaccinations at Decatur Morgan Hospital last Wednesday. 238 doctors and nurses have received the first of 2 doses of the Pfizer vaccine. Decatur Morgan was not on the list to receive the initial doses, and we were vaccinated through the generosity of Athens Lifestyle Hospital, and I would like to thank them tremendously for that. As I promised 3 months ago I would, and I did receive the vaccine, and the only side effect I noticed was minor tenderness at the injection site the following day. I have made the joke frequently that I can barely feel the tracking chip. I hope you will follow our example and get a vaccine as soon as one is available to you. I do believe if you care about others and have a little courage, you will get the vaccine. We hope to get our Moderna vaccine supply soon. Our ICU is full, and I am praying for a Christmas miracle. I hope the forecast models are wrong. I pray the number of infections and death go down after Christmas. I do need your help. I need you to be the courageous voice in your family that stands up and says, we do not get together as a family this Christmas so that we can get together next Christmas. Please be safe, wear your mask, socialize and sanitize. The vaccine truly provides me hope for 2021. As you recall in my September presentation, I ask everyone to be kind during these stressful times. I have noticed that sometimes I get less than loving comments on social media, but be forewarned, I am forwarding all the negative comments to the North Pole. I know there have been a lot of suffering this year. I have seen it, we have witnessed it across this country. We will get through this pandemic, and I believe the vaccine provides us the quickest path back to normality. I hope you and your family do have a Merry Christmas. Mayor?
Dr. Boyle, thank you so much. I took the flu vaccine a month or so ago, and normally it doesn't bother me, but this particular year it made my arm a little sore, but it goes away.
It goes away.
Right, right. I want to correct something that I said whenever I was giving an update. Morgan County last week saw our second highest daily case increase of 144 confirmed cases. So that's just in one day. And then today, I think I see at 108 confirmed and 1 probable. So still very concerning at these numbers. And I couldn't help but to notice that one of your reports touched your heart in a very sensitive way, and I certainly don't want to see us have to go there. So with that, Jen, do we have some questions?
Couple questions for you, Dr. Boyle. I'll start with you. You said at Parkway you have 17 COVID patients. There are only 15 beds in that COVID unit. Tell me a little bit about staffing issues that you're seeing, and did you guys open more beds at Parkway, or are you simply just dealing with the masses at this point?
So we did have a soft start with 15 with our plan to go up, and that number went up relatively quickly. We have had as many as 26 patients over in that hospital. Some of them probably migrate onto the regular medical floor as well, depending on our situation. But we have more patients than we had actually scheduled with that unit.
Do you know if you are having to borrow ventilators? I assume that you guys don't just have, 2 dozen ventilators laying around normally. You said 16 people are on it today. I know 17 were on it last week.
So we did borrow a couple of ventilators. If I'm correct, they came from Helen Keller, and we do have the ability to shift ventilators through the system. We're using multiple different respiratory assist devices, something called high flow oxygen, BiPAP devices. We try to maintain people on on all the modalities we can before intubation. So when they get to intubation, we have gone down a tough road to get there.
I know that you had said that deaths have more than tripled since September. That's only 3 months from where we're at now. I want you to talk a little bit about the deaths. Where are they happening? Where are you seeing this in the community? Obviously, probably a lot of them at the hospital, but I guess I want someone to explain to people at home that, you know, even if your license says Morgan County, but you pass away somewhere else, or you live somewhere else, that death still counts here in Morgan County, and I think people are maybe confused about where I think people still don't think these deaths are happening. So let's address it.
Yeah, I don't know how to deal with all the people that don't believe, you know, the people that think this is just like the flu. You know, I've been practicing in this county since '98. I've never had more than 2 or 3 people on ventilators with the flu in the last 20 years. We always have a lot of patients in the ICU in the wintertime. To have 16 patients on ventilators with an illness that we don't usually have is just unprecedented, which is the word of the year, I guess. We have a lot of patients that die, you know, in the ICU. I don't have the exact total over time, how many numbers that is. We do have some patients that die on the floor that we've been watching them closely on the floor, and then they have a rapid trajectory down, and we can't get them to the ICU quick enough, and they'll have a code on the floor. I'm also work with hospice, and I've had patients that got coronavirus. They were elderly, they didn't want to leave their spouse, and we reluctantly agreed to admit them to hospice so that we could give them comfort on their final days. I don't exactly know how those are counted.
What is this like for you to see this tremendous amount of death from one illness? Like you said, you know, you've only had a few flu deaths in your time working for the last 23 years. What's this like as a doctor and a physician and kind of a leader at the hospital to deal with?
You know, we do see death. You know, that's part of what we do as part of our training. The difficulty this year is just the tremendous number. You know, we can't grieve for one patient before we have to go take care of another. And we can't grieve with the families like we normally grieve. So you know, we're going to see suffering from this pandemic for years to come. That's really the hard part, is that it's so much that you can't recover, and we're just having tremendous amount of fatigue. And the other thing, you know, it's a little disappointing that we can't get people to do the basics, you know, to wear a mask, to separate. You know, it's easy to go in the convenience store and see people not wearing their mask. It's a little defeating.
Kelly talked last week about opening up and transitioning to med-surg plans. Are you surpassed that point?
You know, our biggest problem is not necessarily finding rooms or even finding ventilators. It's maintaining the staff. You know, we have a significant rolling number of staff members that are out with the coronavirus. A lot of them get it from, you know, family members or children, or not necessarily through the hospital setting. You know, if we had 100 ventilators, we couldn't use them all. We just don't have the staff to maintain that. All of that just stresses the system to the point that we don't have physical bodies to take care of all these people.
Can you explain why the solution isn't just sending patients to Huntsville?
I don't know if you follow the ADPH website, but Huntsville, Madison County had 500 new cases peak last week. They're gonna be overrun with patients as well. It really becomes all of North Alabama is going to be run over with coronavirus patients at the same time. You look at Jackson County, Lauderdale County, Franklin County, just go to the ADPH website and you can look at their numbers. A lot of those counties don't have hospitals for patients. All of those will funnel into Huntsville. So Huntsville, will let us know when our resources are depleted, and we will call and say, do you have a bed? And they will tell us no, that they don't have a bed, and we will have to deal with what we have.
I know that, I think it was last week or the week before, that Marshall Medical Center was working on setting up basically a new morgue outside their hospital. It's very dark, and I know that people don't want to talk about that, but I feel like I need to ask you that deaths have tripled in the last couple of months. Are we there? Do we have space to unfortunately talk about storing bodies of people who pass away from coronavirus?
I'd have to get back to you on that. I don't actually know what my morgue capacity is.
Okay. Last thing I have for you. You said, it's disappointing to see people not wearing masks. I was unfortunately Christmas shopping at the mall yesterday, and it was honestly astounding to see people not even under their chin just not have the mask at all. Do you think more strict restrictions need to be put in place, or is it a lost cause, for better lack of words?
I don't know if stricter precautions would make a difference, right? People have to decide, do they care about others? And like Dr. Fauci said, I don't know how to get you to do that.
Jenna, thank you. Don't want to embarrass you, but I want to recognize you. I've had the privilege of working with you for the past couple of years, and you have always been very professional, and you've done your job. And now you're going to move into another market, and we wish you the best. And of course, Merry Christmas to you.
Thank you, sir.
And I think we have another question.
Yes, we have one question from Kelly Smith, 19. I'm going to put her on speaker now. Kelly, can you hear us?
Okay, yes, I can.
Yes, we have one question from Kelly Smith, 19. I'm going to put her on speaker now. Kelly, can you hear us?
Hey, yes, I can.
Okay, please proceed with your question.
All right. So, I was looking at CDC data this morning, and I saw that it is reporting that a lot of hospitals across the state are having issues with supply shortages, staffing shortages, which you mentioned during this briefing. How is the hospital doing now in terms of PPE when we talk about days worth of PPE? With the current supply, how many days worth of PPE do you guys currently have? And I actually, from listening to the briefing, have a couple of offshoot questions from that, which is, exactly what we're looking at in terms of remdesivir supplies and the weekly supply of monoclonal antibodies.
I frequently will sit in on the Huntsville Hospital system setting. We're part of the Huntsville Hospital system, and we've been having no issues with the PPE. We have not had recent issues getting remdesivir. We continue to struggle with where does remdesivir fit into the treatment paradigm, where does convalescent plasma fit into the treatment paradigm. As you mentioned, the monoclonal antibodies are out there, and we have gotten limited supplies. We'll get 10 here, we'll get 15 there. We get them when they show up. We hope to get more of those in the future. Clearly, we've used a few infusions on nursing home patients, hoping that they don't get sick enough to require hospitalizations, but that's, it's not the supply chain is spotty, and we haven't been getting as much, we haven't received as many of those as we'd like in the future, hopefully.
Does that answer your question, Kelly?
I have one more follow-up.
Okay, ask it.
All right, and in addition to that, during the briefing, you spoke about, potentially getting to a point where it's picking and choosing patients that basically, I'm paraphrasing, but are able to receive care or able to get the care that they need when it comes to COVID-19 treatment. I know you spoke to that, but could you elaborate on that? What exactly is leading to getting to that place of having to make that decision? Is it staffing? Is it supplies? If it's supplies, which supplies? Could you kind of describe that situation?
So you're exactly right. It's what supplies do we have and where is the weakest link in that chain? Could it be mechanical ventilators? Could it be nursing? Obviously, for a pulmonologist, we thinking, do I have one more ventilator? If I have one more patient in crisis, do I have that ventilator? It becomes an ethical dilemma to proportions. It would take days to go through. Who, if you have one ventilator and you have 2 patients, who gets that ventilator? Or if you have one patient on a ventilator and you have a patient that comes in and needs that ventilator, how do you make that decision? Is it first come, first served? Do you go through all the ethical principles? Who makes that decision? We currently are working on a committee, and we're working through all of those issues. But like I said, in medicine, that changes us. We don't like to take away things. It affects our core.
How close are we to that situation?
So we will exhaust every possible avenue that we have. If it's a ventilator issue, we will put people in our ICUs. We'll put them in our post-op units. We'll put people on ventilators in the operating room if we need to. But somewhere along the way, we run out. We don't have respiratory therapists to take care of those equipment, or we don't have nurses to give the medicines. This all comes to a stop when you don't have a nurse. I saw a Facebook post, where you see a critical care ICU and you see 12 ICU pumps running, IV pumps, and the nurse said there's not one physician in America that can make all this happen, and they're right. That the weak link becomes the nursing staff. If we don't have the nurses, we don't get this done. So we're not close to that today, but you have seen that in the last 3 months, all of these numbers have quadrupled. We cannot quadruple these numbers. We will reach that point.
What message do you have to the community? I know that I talked to one of your nurses who you had worked with for several years last week. She had come out of retirement to start giving vaccines. What message do you have to people in the community who are in that same spot who may be thinking, all right, I'm pretty healthy. I think maybe I need to go back to work. You need people.
Call us. That's my message. Call us. We'll find a place.
I attended worship online yesterday with First Bible Church, and Pastor Steve Bateman's Word of the Year, I believe, was unprecedented, and it lines up with exactly what you said. Listen, I hope what Dr. Boyle has shared with you today will really sink in. We both want to wish everyone a Merry Christmas and a Happy New Year, and we'll be back December the 28th at 10 o'clock. Thank you.
This was tougher than I thought it was going to be.